meantime, LabCorp ramping up testing capacity for COVID-19. That company announcing last week it has the ability now to perform 20,000 tests per day. Joining us right now on the phone to talk about it is LabCorp CEO Adam Schechter. Good morning to you, Adam, and thank you for joining us. You know, we're having a big conversation about testing and the key and importance of testing. You guys are at 20,000 a day. The question is, what do we need? What's the actual number of tests that we're ultimately going to need, and how quickly do you think they will be made available?
Yes, good morning, Andrew, Becky, Joe. Thanks for having me here today. I also want to thank my colleagues at LabCorp. I'll tell you, they are working every day relentlessly to perform as many tests as they can and to increase our capacity. There's no doubt we're all focused on bringing this unprecedented pandemic under control. So let me give you some numbers. We launched our test about 2.5 weeks ago, and as of this morning, we've reported results for over 100,000 people. And if you look at the next week, we'll be able to do more than 100,000 in a week. You mentioned that we can already do 20,000 or more a day. By the end of this week, we'll have even more capacity than that. But it's not just about LabCorp. When you think about the other national, regional, local labs, academic medical centers, the other hospitals and the state labs, everybody is increasing capacity. So the capacity this week is significantly more than last week, and next week will be significantly more than this week. Right now, we continue to do the PCR testing, but in the future, there'll be point-of-care testing that we'll be able to do in hospitals. There'll also be blood testing that will help us understand the epidemiology of the disease and so forth. So I think that the capacity building continues. It's impossible to know the exact number that we'll need, but I know that we are all going to build as much capacity as we can.
Adam, though, but in terms of the speed and scale of all of this, one of the things the president has been talking about even the last 24 hours is trying to get people, or at least some people, back to work as quickly as possible, possibly even next week. I would imagine that would therefore require lots of testing. At least that's what health experts are saying. You need to get to a point where there's enough testing out there if younger people are going to be no longer social distancing necessarily in the way that they are right now. What do you think is a realistic timeline to have enough tests for a big portion of the U.S., at least the younger generation, if this is the direction we're going to go, to be able to be tested?
Yeah, so the first thing I'd say is that I believe social distancing has to continue under all circumstances in the foreseeable future. And washing hands and the other things that the CDC has recommended should continue under all circumstances. I believe that the capacity that we have for testing is going to increase very significantly over the next several weeks to months. But in addition to that, I believe the serum test will become more and more important to understand who has had the disease or the virus in the past.
Hey, Adam.
Joe?
Something, yeah, thanks. Something that is really a factor here is how many people are in hospitals and the amount of medical personnel that we have, the amount of equipment we have.
So two things. One is there are tests that will be made available that will work quickly. The PCR point-of-care test that should be launched in the not-too-distant future with companies like Schechter, we can actually run those tests in certain hospitals. In addition to that, I don't know if you've heard about the prioritization that's been asked for. So we've been asked to prioritize hospitalized patients and healthcare facility workers with symptoms. And we're doing everything we can this week to figure out how can we ensure that we prioritize those people in hospitals first for all the reasons that you just mentioned. And we will have a solution for that and be able to turn around the hospital inpatients faster as we move forward.
Hey, Adam, another question. Yesterday, we had the Roche CEO on. He told us that it will be weeks, if not months, before anybody who wants to get a test can get tested. Does that sound right to you?
So the bottom line is, as we increase capacity, it depends on how many people are going to need the test. Some people are going to need the PCR test, the ones that we're able to run in a few days. But in addition to that, I believe that serum tests will be available in the not-too-distant future. Those tests will be utilized to help understand who has had the disease, and I think that's going to be very helpful. And you can run those faster, and you can do a lot more of those quicker.
Adam, you keep saying that this is all coming soon, and I think people want to get a real sort of timeline of what soon really looks like, especially given that the president is now talking about revisiting or revising the idea of social distancing starting as early as next week, which I know it sounds like you don't believe is the best course. But nonetheless, in terms of the timeline, which is what I think, frankly, every family wants to understand, what every business leader wants to understand, what every politician and investor wants to understand, what does the timeline look like to you? Simply from a testing perspective, put aside the curve for now.
Yeah, so two things I'd say. First of all, what I said about social distancing is that under all circumstances, whether people go back to work in the next weeks or not, I think that that's going to be important until we have the pandemic fully under control. Second of all, the capacity for testing is increasing significantly every single week. And it's not just LabCorp, but all the other national laboratories, all the regional laboratories, academic medical centers. So I think that that is going to substantially increase over the next several weeks. And we're talking,
but to the point of what, Adam, just put some numbers on it. I mean, do you think we will be at 1 million tests, 2 million tests, 3 million? Are we going to have that type of capacity?
Well, like I said, LabCorp right now can do 100,000 or more a week. By the end of this week, we should be able to do a lot more than that. But then you have to add in all the other tests that are being done around the country, and it is significantly more than that. But then when you start to think about serum tests, I think you can do hundreds of thousands of those as well. So in total, we will have a very significant capability over the next several weeks.
And then final question for you, Adam. What do you charge per test?
So it's currently the Medicare price that we charge for everybody, which is just over $51.
Fair enough. Adam, thank you for all the work that your company is doing. And all we can say is we hope you can even do it faster than you're doing it already. So thanks again.